Well, good morning and welcome to Valley Views. We're certainly glad to have you today. Today we have with us Caitlin Stanley. She is the Director of Marketing and Public Relations for Blood Assurance. So, Caitlin, thank you for being with us today. We appreciate having you.
Thank you for having me.
And we want to start out by, most people know Blood Assurance through donating blood and getting stuff and so forth. But what can you tell us about Blood Assurance that a lot of people maybe don't know?
Sure. So we are the community blood center. We are the provider for over 70 healthcare facilities in the Southeast. We have 11 centers and 13 blood mobiles. So we serve hospitals in Tennessee, Georgia, Alabama, North Carolina, and Virginia.
Oh, wow. That's a lot of average.
Yes, it is. Yeah. And we're expanding as well.
I know recently, talking about expanding, I know recently there's a blood assurance center in Cookville, which was pretty active. Can you tell us a little bit about that, about the storms and everything and what went on there?
Yes, I can. So, very unfortunate disaster that happened in Cookville last week with the tornadoes. Our hearts go out to all the victims. We have a center in Cookville, so we service the local hospital there. We are the community blood provider to that hospital. So we did provide all of the blood to the victims in need, and the community really came together, and there was an outpouring of support. And they all wanted to come back and give back to their community. Right. So we extended hours for our center during that time, all last week, and we opened this weekend, and we provided blood mobiles in the area, as well as did a inside setup in the hospital as well. So we made sure that everybody that wanted to give back, we took care of them, and the support was great.
I understand there were hundreds of people that some of them waited hours to donate.
They did, and like I said, the community really came together. There were a few different fast food restaurants and other local restaurants that provided food to all the donors that were waiting in line. We had volunteers from Tennessee Tech that they came together and showed up and made sure that all the donors that were waiting for hours were taken care of. And our staff, we provided extra staff. So our staff was there day and night, just really making sure that everyone was taken care of, and everyone that wanted to give back to their community in that way was able to.
And I know y'all stay busy even when there's not an emergency. Y'all stay pretty busy. I know on the 3rd Street location.
That's correct.
And you have a lot of people come in there as well.
We do. We have centers in other areas of Chattanooga as well. We have centers in Cleveland. We have a center in Gun Barrel area, Cookville, Tullahoma. So we do stay busy. Regular blood donors is needed. It's what we need. We can't prepare for a natural disaster or a car accident or a trauma. We actually need 540 volunteer blood donors every single day.
Really?
Yes, we do. There's patients undergoing surgeries that need transfusions daily, premature babies, oncology patients, trauma victims. So we do need to stock our shelves and be prepared. So I can't stress enough the importance of donating on a regular basis.
Well, is there a certain type of blood that you need more than others, or?
Well, during a trauma, O negative blood is the universal blood donor. So during a trauma, that is the blood that we need. But there is a right time, and there's our donor care specialists will be able to tell the donors, how their blood can be used, and what kind of procedure they can do to make their blood, used in the correct way. So all blood types are needed.
I'm O negative. So.
Okay, yeah, great.
I know, can you go through a process that when someone donates blood, I know a lot of people want to have their own blood when they have surgeries and things, they want to do that, but what's the process of going through when someone donates blood to check the blood for any type of disease or anything that might be in the blood that maybe they're not aware of?
Sure. So we actually have a lab in-house. We have doctor, nurses on staff. We have a lab technology medical professionals. So we test all of the blood in-house. And our mission is to provide a safe and adequate blood supply to area patients in need. So we make sure to do just that. So we test all of the blood.
So imagine you said you keep the hospitals pretty well stocked from time to time, because the hospitals, they have their blood, but then when they run low, they depend on y'all, right?
We actually are the sole provider to a lot of hospitals in the area.
Oh,
so
okay.
they do rely on us. There's quite a few hospitals that we are the sole provider. So we are the community blood center.
Well, I know I've noticed here in Dunlap and other areas the blood mobiles that go around. You said you had 13.
We do. We have 13, and we're growing. We're getting more.
So they stay pretty busy, don't they?
They do. Yeah, they're out on the regular. I actually noticed that about, I think, a mile, like in the Dunlap area, there's going to be a blood drive next week or the following week, I believe, March 23rd, I think. So it's actually, if you go to our website, bloodassurance.org, you can actually go to make an appointment, and you can search by zip code to see how close.
Oh, okay.
Yeah, you could also call or text or Facebook message us. But if you search by zip code, you will find all the nearest blood drives that are going on. We have several blood drives every single day.
Well, just on a normal day, if you had, as far as number of people that work there at the center, what's a normal day versus a emergency like last week?
Right. So, I honestly don't know the number of staff that we ended up having in Cookeville last week, but we did pull from all areas that we have centers in order to provide enough staff to handle the amount of donors. But every center and every facility is a little different. Every area has their different amount of donors that typically visit us, so it varies. But I know in the downtown center, I believe we have 3 to 4 staff at a time, as far as the phlebotomists that are drawing your blood. And then on the blood mobile, I believe we have about 2 to 3.
I know I used to have to go in once a week because I had an iron disorder.
Oh, okay.
And
Sure.
hemochromatosis. And so I had to have blood drawn each week.
Okay, right.
And, I've got the scars to prove it.
Yeah.
But that was just something I had to do.
Right.
And,
and we do help people out, with those conditions and everything as well. So.
Well, on the blood, for example, are there a lot of maybe this is out of your area, so I don't know that I'm asking this. Like blood diseases that pop up at your center that you catch, or through the
testing and everything. That's definitely not an area that I am involved in. We do have a medical director on staff.
Oh,
She's amazing, Dr. Liz, and she would be able to answer all of those questions. But we do test for everything. I'm not sure about as far as the disorders and everything, but we definitely do test for everything.
Well, I know for many years the HIV virus, that was a big thing, and it doesn't seem like it's been as prevalent in the news as far as, but I know y'all still test for it. We do,
yeah. I mean, we do all of the testing because, like I said, our mission is definitely to provide a safe and adequate blood supply. So we want to make sure we're regulated by the FDA as well.
Right. Well, that was the one thing I was going to ask you. What are I'm sure you have local, state, and federal regulations you have to abide by, right?
We do, yes, yeah. We're regulated by the FDA, so that's important.
Good, because I know they stay pretty busy with things like that because they want to make sure everything's kosher.
Yes, exactly.
And the people who are taking the blood want to make sure that they're getting things that are right too as well.
Right. Yeah, they all go through extensive training.
Some of the things that have come up recently, like the coronavirus, you mentioned that. You wanted to mention some things about that. So what were some of the things you wanted to talk about on that?
Sure. So I know it's on everyone's mind right now.
Yes.
Everyone is releasing statements and everything. So I just did think it's important to also mention that during a time like this, a pandemic like this, regular healthy blood donors are still very much needed. The blood drives that we have, they're not considered like mass gatherings or anything like that.
Right,
They're
yeah.
run by healthy individuals, healthy organizations. And on top of that, we're taking extra precaution to be sanitized and cleanly and all that stuff. We already are, as we're regulated by the FDA. So we do always require, healthy individuals to come out and donate. So just like any other time, it's still important to come out and donate during this time. It's not a bloodborne disease. There's no risk of contracting anything through a blood donation or a blood transfusion.
Yeah, I think that worries a lot of people. That just the fact that maybe they're uneducated on the fact.
Exactly.
It makes them afraid.
Right.
Scared.
Yeah, and they can always call in and are welcome to. Our medical director will talk to anyone that has any questions about that.
I know I've witnessed many times, all the fresh needles that have to come out. I watch that myself even.
Mm-hmm.
And but of course I get blood work done all the time. Because of my health, and I just I watch that myself.
Sure. And I can talk about how easy it really is to donate if you're interested.
Okay,
sure. Okay, so it really is a simple and it's a relaxing process. You walk in and you're greeted, you answer some health history questions, and then a trained phlebotomist draws your blood, and it honestly, drawing the blood only takes about 5 to 10 minutes.
Yes.
And during that time, you can have a snack, you can have a drink, you can watch TV or text your friends or answer some work emails. So it's really made to be just kind of a relaxing environment. And it's a relaxing way to give back. It really is. You're truly giving back to your neighbors and your friends in your community, because the blood goes directly to the hospitals in your area.
Well, is there a certain amount that a person can give over a certain period of time?
So you can donate whole blood every 56 days. So we recommend if you donate whole blood, you come back every 56 days.
Okay, because I know through tests sometimes that blood gets low, the hemoglobin drops, and
Sure. Well, we test the hemoglobin beforehand. So if your hemoglobin isn't a certain level, then we will not let you donate. Yeah, there's definitely, we call it a mini physical beforehand. That's
Yes,
part of when you answer your health history questions. So we make sure that you are equipped to donate.
Well, I've always felt comfortable when I've had to go and give my blood, because, like you said, those questions, you have to answer all the questions, and then the hemoglobin test. I think only one time was I denied because my hemoglobin had dropped, and
Sure.
I wasn't aware of it.
Right, and that's normal. We just recommend you eat a diet full of iron and spinach, and stay hydrated. I mean, you have to take the right steps beforehand, but it definitely does happen.
And I'm also I love coffee. That's my favorite. But I know coffee thins those veins. You need water to break those veins out.
We do recommend avoiding caffeine, I think 24 hours beforehand, and just drinking water and Gatorade and things like that. And we have all of that there for you too. We have snacks and fruit juices and water and Gatorade.
Well, I know you mentioned how it's a relaxing atmosphere.
Mm-hmm.
It has been for me when I've been there, and I've never felt uncomfortable. And
Good.
Sometimes I didn't like some of the TV programs.
Sure.
But that was always on, so I
Yeah.
just watched it. But it's always been a relaxing atmosphere. The people there have always been good to me, and I've never felt ill with anybody there. It's always been a good environment.
Good. Well, that's very nice to hear.
And, well, are there any plans for any blood drives coming up that you're aware of, that we can be aware of to put on our?
Sure. So it's March 23rd is the one that's only a mile from the center of Dunlap. It's the Cooperative Resource Center, I believe.
Oh, yes, it's just up the road.
Oh, okay, perfect. So yeah, March 23rd. I believe it's from 12 to 4.
12 to 4.
Mm-hmm. And there's various other ones around. There's an elementary school. Is it Palmer Elementary?
Palmer, that's in Grundy County.
Okay, so there's also one there, I think, that same week.
Uh-huh.
And there's quite a few others that you can find on our website if you search by your zip code.
Well, you mentioned a while ago about Georgia and Alabama. How far down do you go in Georgia and Alabama?
We have a center in Dalton, so that's, I think, as far as we go there. But like our blood mobiles can also go into other little areas. But it's northern Georgia, northern Alabama.
Oh, okay.
Mm-hmm.
Well, I was thinking I'd seen or heard some things from Dalton about y'all doing some work there and how that works.
Mm-hmm.
And well, is there something you want to tell anybody or everybody here that about the work y'all do, or the blood work through blood assurance, that they can be more aware of? Anything that we haven't brought up yet?
Sure. I just like to mention that we are the local blood provider. So I think just the fact that we're local is important, because you never know when something could happen, to a family member or a neighbor. And so we are the local blood provider, providing to area patients in need. And then also I think it's also important to just mention how easy the process is and how it truly is a way to give back. I actually donated for the first time just a few weeks ago.
Oh, yeah?
Yeah, I did. So it's a very easy process. And once you do it once, it's easy to come back again, because you get over any fears you might have. And our phlebotomists are great. They go through an extensive training, and they're there to take care of you.
Yeah, I've always found of course, I get stuck all the time for my blood work, so I'm kind of used to being stuck. But I found out when I was at Blood Assurance Anytime, they're pretty good about finding those veins and going right in.
Oh yeah, that's what they do daily. They do it on the daily, so they're very trained, and they know what they're doing. So.
And they always seem to put me at ease. When I was there, they always cut up with me, laugh, and joke, and so they're good, friendly people to be around.
They really are, and if you are a regular blood donor, you gain that relationship and that bond. I'd say there's definitely a lot of regular donors that are friends. They're friendly with our phlebotomists, and they can talk about, like, how's your day going, how's your cousin, so you can build a relationship for sure.
Was there anything like I know one time I was sick right before I had to go in, and I'd taken some medicine, and it messed up my blood work.
Sure.
Is there anything people need to know about that? If they're sick, maybe they shouldn't donate, or
right. Well, we do mention that you shouldn't feel sick when you come in. Like, we don't want you, if you're sick,
right.
Stay at home and get better. But if you feel healthy, then you can come in and donate. And there is a list of medicines that, if you call in and you have a question about a specific medication, we can tell you whether or not it's okay to donate. But there are a lot of myths too. There's not a lot. We don't turn a lot of people away. Like, you can donate. We hear it all the time. Like, I have a tattoo, I can't donate. Well, actually, you can.
Yeah.
So.
Yeah, I know there's a lot of rumors out there. I've heard them many before, and but you want people to donate because that's your lifeblood when you need it. And like you say, you can't predict like tornadoes, or
exactly,
or like a few years ago the servicemen who were shot and killed that day, and things like that you don't predict.
Right.
And you don't want to predict, really.
No, exactly.
But,
it's very unfortunate, but it is helpful if we're prepared, and that means by having regular donors that come in before that happens.
Well, and I know I saw many pictures of the tornado victims, and people were stressing. This is why we call Tennessee the volunteer state, because people were just out.
It's true.
I think in Cookeville they had to turn away volunteers because they had so many.
Very true.
And that says a lot about this area and
It
about
does.
the people. I know Saturday there was a trailer here that was sent with goods throughout the valley south of us. They matter of fact, I was in town when a convoy of trailers went through. And they were from Jasper and Kimball and Whitwell. So,
yeah.
All volunteering.
Yeah, everyone is really coming together. And even people in the Chattanooga area, they're coming in and wanting to know how they can help and how they can give back. So it is definitely a great state to be a part of. Tennessee's definitely the volunteer state.
Well, other than blood, do y'all ever take donations from someone that would like to just donate to help y'all out, or?
We do different like tournaments and sponsorships and things like that. Like we actually have a golf tournament in May in Tullahoma, which that's not too far from
No,
you
it's-
guys. Yeah, so we do scholarships. We do 12 scholarships a year to high school students. It's called the Crystal Green Scholarship. It's in memory of Crystal Green. We've been doing it for several years. And we will host a golf tournament in Tullahoma every May. It's May 8th. You can go on our website and find more information
Okay.
about it. But it's in order to raise money for these scholarships.
Oh, well,
so
good.
it goes directly towards the high school students.
Well, good.
Mm-hmm.
Well, I know the times I've been in there, I always see the posters where it shows people that are living today because of all the donations of blood, because where they lost a lot of blood in accidents and whatnot.
Right.
So I know y'all do many good works.
We do, yeah. We do different donations and partner with other organizations and charities and nonprofits as well. If you have an organization that you're a part of, we'll give back in that way as well. So we're actually working on possibly partnering with a charity in the Cookeville and Middle Tennessee area, so that way the people that are in the surrounding areas, such as Dunlap and Chattanooga and Cleveland and all that, they can come in and donate, and in return we'll donate a portion to the charity, like $10, for every donation, something like that. We do that sometimes as well,
Okay.
just to help out our community.
What if someone they would go to the Chattanooga office and donate, but say, for example, they were in Cookeville like the other day, could they go there, and would their records be there? Or
Definitely. Yeah, we keep all of the records. We have donor IDs, individual donor IDs for everyone. So,
Oh, okay.
yeah, we keep all of that information. And for instance, if someone wants to call in and check and see when the last time they donated was, and if they're eligible, like, we have all of that on file.
Oh, okay, great. Well, that's good.
Yeah.
Well, Caitlin, it's almost time for us to close, and we're certainly glad that you come over today and to be with us, and enjoyed your time here, and actually learned a lot about blood assurance.
Oh,
And,
good. Well, thank you so much for having me.
well, I appreciate you driving over here, and I know it was a little drive from you, but get a little time off and
Yeah,
relax.
exactly. It really wasn't far at all. It's about 45 minutes down the road. So
Well, I appreciate you coming. Thanks.
thanks for having me.